Okay, Faza Kamzala, working for Ubuntu Education Fund as a monitoring and evaluation manager, acting for clinical manager.
Looking at the fight against the HIV and AIDS right now, what would you say is our challenges in 2011?
As people who are working with HIV and AIDS in this community, we still need to work together as NGOs, CBOs, as well as the Department of Health. So that's the challenge that we're having, because right now, yes, there are certain organizations that we would know that are doing the same thing, but not really knowing what we're doing as Ubuntu, so to be able to help each other to take away the load in terms of, because there are so many people that are infected, and there are so many kids that are infected themselves, and some are affected because their parents are living with HIV. So obviously, if we can work together, and that will make the difference into the community that we're working in. But then the issue or the challenge is with the, in clinics, they have a problem in terms of staffing. There's few nurses that are in the clinic, but there's so many patients, and they have not enough resources to assist in terms of doing HIV management. So as Ubuntu, since we are having this partnership with department, we are in a process right now, working closely with the department to be accredited as right now in December, around the 15th. We're in that process so that we can be accredited as an ART site, so that we can be able to take away the burden from the clinics, so that we can also assist the government to make sure that everyone within this area is able to come to Ubuntu and get the treatment as well. We're servicing EEBI. You know, EEBI was from New Brighton up until to Joslo. We're not working in Malawi, and we're not working in urban areas like your Mission Vale, going towards Olokolo, going to the colored areas.
Okay, and then going back to my initial question, the child-headed families, would you say ever since you guys were established here in Sweden, would you say child-headed families has increased, the rate has increased or decreased, and if so, why?
All right. The rate has decreased because right now what we are seeing is that people have gone back to providing Ubuntu, not Ubuntu as an organization, but Ubuntu humanity, whereby you find that when a child loses the mother and the father, there will be somebody within the family that will take the kids to stay with them. It can be an aunt, it can be an uncle from maybe another part of Eastern Cape or wherever. That's the main thing that is happening. And the other thing that we see instead is that kids, they are they get the reputation in terms of being orphaned, because also the aunt will pass away, and then kids again had to find somebody else to stay with them. And also the other thing that we've seen is that within the community, even neighbors are able to take care of those kids that do not have parents, where they will take those kids to stay with them. Since we are working closely with the Department of Social Development, also they having the same issues as the Department of Health, because they have so many cases when it comes to kids that need to be placed somewhere. So for our side, it would be nice if maybe whoever that is a responsible person to assist in this area, where maybe Ubuntu can be seen as an organization as well that can help, where we would have a registered social worker that can do the same thing that is being done by the social workers at social development, so to be able to assist the kids for those kids who doesn't have maybe families, we can put them into homes. Because right now, whenever we get to that step, we had to go back to social development and they open a file and then that kid will be in a waiting list rather than having a fast track process to make sure that those kids, they get a safe home as soon as possible. Because I believe that knowledge is power. Most of the people, they know about HIV because we as Ubuntu and other people that are working in the field of HIV within IBADI, we ensure that people understand what is HIV and how to prevent yourself from being infected in those areas. So definitely people are getting there, because right now we are also doing voluntary counseling and testing on site and in the community. So the numbers are high in terms of people that are just coming voluntarily to know their own status. So that shows people understand and they need to know if they are infected so that they can be able to manage, and change their behavior in terms of ensuring that they live a longer life. The numbers in terms of people that are testing positive are very low. On a daily basis, it happens that a week we will test more or less about 50 people, but out of that 50, it's possible that we don't get anyone, or it's only one person that is HIV positive. Because normally we test between 15 a day within one site. So it has decreased in terms of getting the positive results from the people.